I'm Nicole Lee with Health, Beauty, and More, and I'd like to discuss a little bit about fibromyalgia. Fibromyalgia is usually a chronic syndrome. I don't want to call it a disease or anything. It's more like a syndrome that affects people, mainly women, but men could be affected as well, and it's diagnosed by a physician. In particular, if you were to go to a rheumatologist, that would be a good specialist to get a positive identification, and I believe they might even have blood tests possibly to confirm fibromyalgia now. But what I want to get into is that when someone has this syndrome, they come to the doctors with fatigue, muscle pain, and specific points on the body that can be identified as tender points or trigger points. There are 18 of these altogether. And there was a small study done on women who took vitamin D3 for a 20-week period, and then another group of women that took a placebo. Nobody knew who was getting what. And they noted improvement in the ones who took the vitamin D3 with their fibromyalgia symptoms, which is encouraging because it is part of your bones that it is absorbed into. And the recommended international units of vitamin D3 for people over 70 is 800 international units, or IUs. And people 51 to 70 years old, the recommended international units are 600 IUs. And if you're at home and you're having a lot of pain, it could be headachy and back pain, you could be having all kinds of muscle pain and fatigue. There are some things you can do to help treat that. Make sure you're getting enough rest and your diet is good. Try to reduce your amount of stress because that can definitely affect fibromyalgia symptoms. Try doing some deep relaxation techniques, or find a yoga or Tai Chi or something similar if you like to get involved with that, to help get in touch with your chakras and get yourself relaxed. Learn how to breathe through the belly. Get regular routines established at bedtime. Gentle exercise daily is helpful for people with fibromyalgia, even though you feel, well, it's the last thing you want to do is exercise, but it's the best thing for you. There are certain factors that can affect and trigger fibromyalgia or worsen it, and one is the weather. Another one is fatigue. Another one is anxiety. That can affect your fibromyalgia symptoms and worsen them. In some people, it can be hormonal related that trigger the increase in fibromyalgia symptoms. And then there's also a group of people that have a very sedentary lifestyle, and that increases the fibromyalgia pain. It also kind of gives you time to, I guess, focus too much on it. So try not to focus too much on your symptoms. Anyway, I hope this helped you. And for those that suffer with fibromyalgia, I am so sorry. But please take care of yourself. And if it really gets to the point where you need to sleep on ice packs or cold packs, try doing that in the areas that hurt the most. And maybe just some NSAIDs. Those are the steroidal anti-inflammatory agents, like Advil is one, ibuprofen's one. They're all out there over the counter too. But don't overdo it on it, because that can affect your kidneys in the long run. If you start taking them every day, it can definitely affect your kidneys, and then you'll have internal organ problems which you don't need in addition to your fibromyalgia. So try to be happy and relax and enjoy the holiday season, and stay out of situations that increase your anxiety or stress, and just take these precautions. Take care of yourself too. This is Nicole Lee with Health, Beauty, and More.